Hello. Now we will discuss the management of all different types of scenarios, dermatological scenarios, right? So the first one is basal cell carcinoma. You have to explain the diagnosis that it's a very common form of cancer, skin cancer, right? Then in terms of management, right, when the patient comes to know that it's a cancer, they get nervous. So you have to tell them that you have to reassure them, tell them that don't worry, you need not to worry, it's a common condition, it's mostly treatable, right? And it's a very common, and the biggest risk factor is the sun exposure. Tell them that it grows very slowly, it stays localized, doesn't spread, right? And then in terms of referral to the skin doctor, the dermatologist, you have to see that if the patient is having the carcinoma on the back of the head, so you have to do the routine referral. And if the patient is having the carcinoma on the nose or on hairline, so you have to do the urgent 2-week referral. So once the patient is referred to the dermatologist, what a dermatologist will do, he will closely examine the lesion, right? And he may take biopsy for confirmation. After confirming, so the best treatment is surgical excision, or he may do a freezing therapy called as cryotherapy, or topical treatment for superficial lesions, right? So but the best and most common treatment is surgical excision, right? You can also mention the Mohs microscopic surgery. It is very important, this term is very important, right? Try to name it. Mohs microscopic surgery, it is for the sensitive areas, right? If it's on the nose, or if it's on the close to the eyes, right? Then safety netting and leaflet, you have to give the leaflet. For safety netting, tell them that if it's become severe, painful, or bleed, or something like that, so you have to immediately come to the hospital. Then squamous cell carcinoma, you have to tell diagnosis that it's one of the common type of skin cancer. In terms of management, again you have to reassure them that you need not to worry, it's a common type of cancer and it is very treatable, right? It's developed years after the skin exposure, to the sun, right? And it's mostly present on the face, arm, scalp. Then in terms of referral, you have to refer the patient to the skin doctor, that is dermatologist, right? It's a 2-week referral. It's a 2-week referral cancer pathways, right? Then what the doctor will do, what a dermatologist will do, he will take a biopsy, he will closely monitor, he will closely have a look over the lesion, and he will confirm it. Once confirmed, so the best treatment is surgical removal under the local anesthesia. Only a part of lesion will be anesthetized, or will be given local anesthesia, and it will be surgically removed. Right after that, the doctor may go for the radiotherapy treatment, right? Also, and the patient will get fully recovered after taking the treatment. The patient may ask about the surgery, that if it's a day procedure or not. So you have to tell them that it's a day procedure, it's a simply removal, and you will get fully recovered after 1 to 2 days, right? And you should tell them that the biggest risk factor is the sun exposure. Then safety netting and follow-up. For the safety netting, again telling them that if the lesion gets severe, painful, itchy, bleeding, or it's changed its size, shape, right? Then you have to seek the medical help, urgent medical help. Then follow up and leaflets, you have to give them the leaflet that, and tell them that it contains all the information about the squamous cell carcinoma, right? We will also Hello. So we were discussing the management of different types of dermatological scenarios. So the third one is suspected melanoma, right? So tell them it's a very serious cancer, and it can be due to a pre-existing mole, or it can be new growth as well, right? It is due to the pigment cells in the skin, they grow in an uncontrolled way, right? And it is really concerning because it has changed its color, it changed its size, right? All this, tell them these things. Then in terms of management, what we'll do, you have first reassure them, right? Reassure them, tell them that early catching makes a big difference, right? And the changes you have noticed, and all these that are very important, and we have to urgently refer you to the skin doctor, that is dermatologist, right? And it will be a 2-week cancer pathway. And what the dermatologist will do, he will take a biopsy, he will have a close look to the lesion, right? And once the lesion is confirmed to be a melanoma, right? So he will surgically remove it, right? Also tell them about the sentinel lymph node biopsy. What sentinel lymph node biopsy is that? To check for the nearby glands if they have if they have involved them or not, right? Also name the additional treatments like chemotherapy, radiotherapy, or new treatments like immunotherapy, right? That the doctor, after removal, the doctor may go for these therapies as well. The patient may ask for the risk factor, so tell them that the sun is the biggest risk factor, right? And tell them that it does not spread, right? It stays localized. For the safety netting, tell them that if if it bleeds so much or gets really painful, so you have to seek medical help, right? Leaflets, give them the melanoma leaflet, right? Then is seborrheic keratosis, right? So you have to explain the diagnosis, tell them that it's a very common and non-cancerous harmless condition of the skin, right? Lesion of the skin. They are sometimes they are really concerned about the lesion, so they think that if it's a cancer, so tell them it's a non-cancerous harmless condition, right? And tell them that it can be removed only if there is irritation or for cosmetic concerns. In terms of management, you have to keep in mind that if the patient is giving the history of melanoma or not, right? If they are not giving any family history of the melanoma, so tell them it's a benign growth, it does not require any medical treatment, right? And you have to tell them that if it get itchy, bleed, or any, if it changes color, size, right? So you have to seek urgent medical help, right? And for the cosmetic concerns, tell them that the NHS don't cover, and you can guide them for the local private dermatological clinic, right? So there they can get it removed. Okay, and if the patient is giving the history of family history of melanoma, so what then? You have to shift the patient. You have to that is for the 2 weeks cancer pathway, you have to refer the patient to the skin doctor, that is dermatologist, right? What the dermatologist will do, he will be having a dermoscope, a tool. It's a tool that is that the dermatologist take photos with it for the future comparison, right? And they may have a they may take a small biopsy uh, to confirm it if it is having any cancer changes or not, right? Then safety netting, again same. They tell them if it bleed, if it changes size, color, right, shape, so you have to seek urgent medical care, right? Then is cholinergic urticaria. Cholinergic urticaria is also very important, right? You have to explain the condition, that it's a harmless condition, right? And right, tell them that when the body gets gets heated, so it releases a chemical called as acetylcholine, right? And acetylcholine is responsible for all these redness or bumps in the body, right? Then in terms of management, first we have to reassure them. Sometimes the patient are very concerned, that why so you have to reassure them, tell them that it's not an allergy, not a dangerous, it's not any right, not an anaphylaxis, something like that. Tell them that it can be cured with antihistamines, right? Antihistamines, they can be they are present in the local pharmacy. It's an over the counter, right? Then tell them that you can use it before non triggers, right? Or you can use them after a rash appears. Then is you have to give them the advice. For the advice, tell them that take a lukewarm shower, not so much hot water with the hot water, right? Avoid dressing the child in warm weather, right? Then adjust the indoor room temperature if it's too hot, right? And you have to use antihistamine before before playing outdoors or before non triggers. And also give them about the travel to the hot countries, so they can use the so they can take up the antihistamines, right? Safety netting is very important. Why? Because tell them for if the patient is having any swelling in the lips, right? Or they may have any shortness of breath, or they may feel dizziness, pain, so they have to seek urgent medical help. They can call an ambulance as well. It can be a severe medical emergency or severe reaction, that can be an anaphylaxis, right? Then follow up and leave letters, right? Thank you.